This paper shows that individuals with a high BMI have an accelerated waning of vaccine effectiveness, specifically with COVID vaccination. This tells us that people on the higher side of the BMI scale need to be given more than one vaccine a year, as they are clearly a high-risk group for severe COVID infection. So we know that obesity is associated with an increased risk of severe COVID infection and mortality. This paper looked at 3.6 million individuals in Scotland using the Early Pandemic Evaluation and Enhanced Surveillance of COVID-19 Surveillance Platform, also known as EVE2. In their analysis, they found that vaccinated individuals with severe obesity with a BMI over 40 kilograms per meter squared, these people were 76% more likely to experience hospitalization or death from COVID despite being vaccinated. On top of this surveillance health data, they also did a longitudinal study, where they looked at 28 individuals with severe obesity and compared it to 41 control individuals with normal BMI. They found that over half of individuals with severe obesity had no neutralizing antibody titers at 6 months, compared to only 12% of individuals with normal BMI. Additionally, they observed that individuals with severe obesity had a neutralizing capacity that was lower than individuals with normal BMI. However, neutralizing capacity was restored with another dose of the COVID vaccine, but again, it declined more rapidly in people with severe obesity, showing an accelerated decay profile or an accelerated waning of vaccine effectiveness in people with obesity. So currently the US CDC recognizes that immunocompromised individuals need a vaccine every 2 months with doctor approval, that people over 65 also need more than one dose a year, and then we also have people with obesity that currently only get one vaccine a year but clearly need more than one vaccine a year. This means for the next ACIP meeting, we really need to push for that to be added to the criterion for people that need more than one vaccine a year, even though everybody should be getting more than one vaccine a year for COVID. This is another high-risk group that we need to fight for. This is especially so because they're not currently recognized as one of those higher risk groups that need multiple vaccines a year. Now, let's continue diving in. So globally, obesity is defined as having a BMI greater than or equal to 30, and severe obesity is defined as a BMI of greater than or equal to 40. And about 9% of the US population is defined as having severe obesity, which is also associated with a 90% higher risk of death from COVID-19 than the general populace. Furthermore, for breakthrough infections, these are infections that evade prior immunity. We know they occur more rapidly in individuals with severe obesity at both 10 weeks and 20 weeks after vaccination, suggesting a more rapid waning of protection from vaccination for people with obesity. Interestingly, in their longitudinal study, they show that the peak neutralizing antibodies are similar in individuals with normal BMI and for those with obesity, indicating that the initial vaccine responsiveness is similar between the two groups. However, this initial vaccine response is not sustained and has a much more rapid waning over time, which means, as I stated prior, that COVID-19 vaccines may need to be administered more frequently in individuals with severe obesity to achieve the duration of protection from COVID that is seen in individuals with normal BMI. And that's protection against the more severe instances of COVID. And outside of advocating for this policy, there's also a pressing need to ensure appropriate demographic representation in clinical research studies and trials, which must seek to include individuals with varying degrees of obesity, which is something that currently is not a standard in these studies. And then to paint this picture, about 70% of the US population is classified as either being overweight or obese. That's more than 2/3 of all adults. And I also need to emphasize from our last two literature reviews that it's not an effect of needle size. For the COVID mRNA vaccines, it does not appear that the needle size is significant in creating an immune responsiveness for COVID vaccination. However, that may not be true for the Novavax platform, as that is a protein-based vaccine. We can only say that for sure for the mRNA-based vaccines. So again, this was a study that looked at Scotland, about 3.6 million people over the age of 18 who had received a second dose of the primary series vaccine or a third booster dose of that same vaccine, and the study was conducted between December 8th, 2020 and March 19th, 2022, where the BMI was recorded for about 1.7 million people. And from their analysis, they found that people with severe obesity were at an increased risk of severe COVID outcomes after a second vaccine dose compared to those with normal BMI. But also of note, a modest increase in risk was also seen in individuals who are obese and those who are underweight. Additionally, they found that individuals with obesity and severe obesity were at a higher risk of hospitalization or death from COVID after both a second and a third booster dose of the primary series vaccine. The authors also found a modest increase in severe illness or death in males as opposed to females, where there was about a 30% higher risk in males as opposed to females. Moving on to the longitudinal study, the initial immune responsiveness was not different between the two groups. However, after 6 months, the neutralizing antibody responsiveness was significantly less for those with severe obesity than it was for those with normal BMI, where it's basically an order of magnitude less at 6 months. And it's also important to note that this is not unique to COVID vaccination, as these findings are similar to those seen in individuals with obesity after influenza vaccination, where they also find no difference in early immunogenicity, early immune responsiveness, but they see quicker waning over time.